So now that we know which cases require a sinus lift, let's talk about how to communicate it with your patient. You can be an excellent doctor. You can be extremely knowledgeable. You can be so confident in your clinical abilities. But if you can't communicate it to your patient, then you're not going to get the case acceptance, and you're not going to be perceived as a good doctor, because many of us failed in communication, are still failing, and communication is so important, because when you don't communicate properly, you just don't sound knowledgeable. It's just one of those things. The way you present yourself, the way you show yourself to the world, you have to be able to communicate that. And if you don't communicate properly, you also don't sound confident. It so happens that patients are looking for these two qualities, these two traits. They want a knowledgeable doctor and a confident doctor. And there are other important things that we want to have. You want to be a safe surgeon. You want to be, a good have good bedside manner. You want to have, really good human skills. You want to have a nice setup practice. You want to have a lot of other things. Good sense of humor helps, but knowledgeable and confident is very important for the doctor, and it comes from communication. So the first tip that I'm going to give you is, when you are assessing a patient for implants in the posterior maxilla and you're suspecting a sinus proximity, don't make unfounded statements. It's not a great thing. For example, don't say you don't have enough bone. Don't say you will need a sinus lift. Don't be dogmatic about it. Don't say you got enough bone or you will need a sinus lift. Don't say these things before looking into things, even if you feel like that's the case or it's pretty obvious, because your patient is going to perceive you as a hungry surgeon, and it will not, he or she will not perceive you as somebody who is knowledgeable. Instead, I'd like you to say the following, okay, in your own words, in your own language, in your own style. Show your patient what's going on. Here's where the implant goes. Here's the sinus. Point to the sinus on the image. It's a two-dimensional image. It's very easy, or Panorex. Looks close, right? Or looks close, doesn't it? You can show them the floor of the sinus. And then you say something like, okay, without making those bad statements, I need to get more information, and I need to study how much bone you have and where the sinus is exactly. And the reason I'm mentioning these things, it's basically I'm communicating to the patient what I'm suspecting, what I think could be happening, but I'm not making unfounded statements which are not very well perceived by the patient. And I'm setting the patient up for getting a CT scan. A two-dimensional image is not enough for you to evaluate for implants. That's the standard of care is to get a three-dimensional scan. And you can't just look at an X-ray and order a scan or send the patient to be scanned. You need to communicate why. And in 5 sentences, you're able to do this. Okay, so CT scan comes next.